Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, as well as Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang.
Thank you, Chrissy, and good afternoon, everyone. Sadly, we have to announce another death to COVID-19 at Northwood. To that family, I express to you these sympathies and condolences of all Nova Scotians, and a hope that you find some comforting way to mourn in the midst of all of these restrictions that are placed upon our province and community, and know that you will be in our thoughts and minds in the days ahead. This virus has been a vicious one and is taking its toll on Northwood. I want to assure families that we have an emergency plan where we have brought together extra health staff, infectious disease experts, and extra cleaning staff. The Health Authority, our health department led by Minister Delory, and the Northwood team have all been working together to protect residents. A growing number have recovered and have been moved to a local hotel, and we are doing that to protect them and to isolate the virus. These are difficult times for our province. Not only are we mourning the lives lost of COVID-19 and those who died of the horrific tragedy of April 18th and 19th, but now a helicopter crash off the coast of Greece has claimed the lives of 6 members of the Canadian Armed Forces who were also part of our Nova Scotia community. In the past 7 weeks, our province has experienced a tremendous tragedy. I'm worried about all of you, and I'm worried about how we are coping. So we need to get out of our heads and out of our houses and get outside. We need to feel that fresh air, a little freedom. The key word is a little. Today, Dr. Strang will announce some measures to loosen restrictions around recreation and outdoor activities. These are good for our physical health for sure, but they're extremely important for our collective mental health as we go forward. Dr. Strang.
Thank you, Premier, and I too would like to give my condolences to the individuals who died in that helicopter crash, their families, and to our military family. One tragedy after another, but very sad. I'll give a brief update on Nova Scotia's cases before outlining some of the first steps in Nova Scotia's COVID-19 recovery plan. We do have, unfortunately, one additional death related to COVID-19 at Northwood, and my condolences and sympathies to that family as well. We announced these deaths, but we have to remember that not just numbers, there are people and their families behind them, and each of them are grieving, and my sympathies to them. We now have 12 new cases of COVID-19 today, bringing us to a total of 595. And we have, out of that total, we have 10 individuals who are in hospital, 3 of those in intensive care. We have 592 people who have recovered, and unfortunately we've had 29 deaths. On the good side, we've had 28,883 Nova Scotians who have been tested, and their tests have been negative. And again, an indication of the success of our testing strategy, reaching out broadly to test lots of people. We have 10 licensed long-term care homes and unlicensed seniors facilities that have had at least one case of COVID-19, and involving a total of 237 residents and 105 staff. Referencing our testing capacity, the QE2 lab continues to work effectively, and yesterday they did 812 tests. And again, we have lots of testing capacity. It's critically important to remind every chance I get that any Nova Scotians who have symptoms that could be COVID-19, and those symptoms are if you have 2 or more of fever, new or worsening cough, headache, sore throat, runny nose. If you have 2 or more of those symptoms, if you can do the online 811 assessment tool, do that. If you can't, phone 811 telehealth line, and you'll get further direction from there. It's important that we continue to look for and identify new COVID-19 cases, and then rapidly apply public health measures around those cases. As the Premier mentioned, we're now in a position where we can actually start to lift a few of the restrictions that have been in place. These are the first steps in our recovery plan. It's critical that we take a measured approach. We don't want to rush into this and undo the progress and the results of the hard work by all Nova Scotians that we are able to have in the last few weeks. I know that that these restrictions have created a lot of challenges for families, for individuals, for businesses. I know many people are tired of staying home, and that we all just want to see some light at the end of the tunnel. That's especially true that the weather is nicer and there's it's hard not to be outside. And we want to actually encourage people to be outside. Being active outdoors, as the Premier said, is important for both our physical and our mental health. And this is especially important as we're dealing with the stresses of COVID-19, the mass shooting, and now the crash of the Canadian Forces helicopter. So we want people to get outside and for those reasons, but it's really important that we all do this safely and then do this in a way that continues to follow public health directives. So I'm going to go through some of the details of what's going to open up as of 3 p.m. Today. So first, we have provincial and municipal parks can reopen. This includes sports fields as well as school grounds in the Halifax area that were closed as a result of our previous order. Any trails that were closed can now reopen. We ask that as much as possible that you do not drive to parks and trails, but you enjoy what is available in your local community. That goes for ATV users as well. As many trails, in addition, many trails also only allow single file, so it's important that we those single file trails if you come across other people, that you're stepping off the trail, respecting social distance. If people do need to drive within their community to get to a park or trail, it's important to not create crowded parking lots or roadsides. If there's already a significant number of cars there, please don't stop. Go somewhere else. We need to. We're opening these up, but we need to be safe. We need to use good common sense about how much we congregate together. We need for COVID-19 to spread. It needs to be. People need to come together. So while we open up the outdoors, we need to still stay separated to the extent possible that prevents the spread of COVID-19. Community gardens can also open. These gardens are important for many reasons, including how they help address food security, which is a critical issue in many of our communities. All provincial and private campgrounds, however, remain closed, except to perform necessary maintenance to prepare to open. However, private campgrounds can open for seasonal campers in fixed RV campsites. No weekend or short-term campers are permitted at this time. Nova Scotians can go to their cottages, but we're asking them to do that with their own family or household unit, people that they already are living together with. And we're also asking to not go back and forth frequently, but choose as much as possible a primary residence. Minimize the movement back and forth between your home and your cottage. If you happen to have a private boat launch, we're asking that you can certainly go boating, but only go with members, people who are within your household. Now isn't the time to start to invite friends and neighbors to join you for whether it's boating or for picnics or we still need to be socializing within our household unit. Sport fishing can now reopen, whether it's from the shore or from a boat. People, however, need to continue to practice social distancing on the shore and at the boat launch. And if they're boating, it must be with people that are within their household again, people that they're already living with. People are also encouraged to do this within their local area and limit their driving for fishing. There will be no derbies or fishing festivals allowed at this time, and people from other provinces towing fishing boats are not going to be allowed to come into Nova Scotia for sport fishing at this time. Sailing and boating clubs can now open to allow people to prepare their boats for the season. And food services within marinas will be limited to takeout like other restaurants. Golf courses can open their driving ranges and begin maintenance work to prepare to open fully in the weeks to come. The workers, like other businesses, must maintain social distancing, and those using the driving ranges must also maintain that social distance of 6 feet. Again, clubhouses that serve food and beverages will be restricted to takeout only. Excuse me. Drive-in religious services will now be allowed as long as people stay in their cars, the cars are parked 6 feet apart, and there are no exchanges of people or materials between cars. So that means no passing of things like collection plates or communion. Again, we're asking only that in any single car, that it's only members from within a one household that are in that car going to a drive-in religious service. We know that many people want to get started on gardening and spring home maintenance. Garden centers will be opening and are allowed to open, but people must use them safely, respecting physical distance and numbers as they do in grocery stores. While I'm on the topic of shopping, I do want to remind people that there should only be limited necessary shopping. We ask people to do that safely. Plan ahead so you shop no more than once a week and have only one person per household go into the store. Certainly, my observation over the last couple of weekends has been that for many people, this seems to have been forgotten. So we need to respect the rules and also use our common sense so we're shopping safely, protecting those who are willing to continue to come to work to allow us to do the shopping that's necessary. For now, all beaches and playgrounds will remain closed, though we hope to be able to reopen them soon. Most of us don't have a beach in our community and would have to drive a fair distance to get to one. And we really don't want people driving long distances if they don't need to. Playgrounds have many challenges to maintaining social distance for kids, plus have many high-touch surfaces that cannot be sanitized. So for those reasons, for now, we're keeping beaches and playgrounds closed. These are the initial steps in our recovery plan. I do want to stress that the existing public health directives around maintaining social distance, social gatherings should only be when essential and no more than 5 people. And as much as possible, we want people to enjoy the outdoor activities, but do that within your household groups. Those are going to be important, and even as we continue to open things up further, those core public health directives are going to remain and need to remain in place. Our ability to go further, to open up further in outdoor activities and open up other areas will really depend on how these first steps go. Are they done safely? And are Nova Scotians, will they continue to follow the public health advice and directives? So this is our first step. Our ability to go further will depend on all of us working together to make sure this goes well and is done safely. I also want to remind people that good hygiene practices continue to be a key part of protecting ourselves, minimizing the spread of this virus. Washing your hands well and often, sneezing into or coughing into a tissue and then throwing that away and washing your hands or into your elbow, avoiding touching your eyes and mouth anywhere in your face, especially if your hands are unwashed. Those are all very important of how we protect ourselves. People can also consider using non-medical masks, especially when they're out in public and where it's difficult to maintain social distance. We all need to do these things. We all need to practice good common sense and looking out for one another. I know that for some people that it may be fully hard to understand all why we're doing certain things and why other things are not being opened up, and that there's a lot of questions that people may have on whether something's a law, whether it's required, or whether it's part of the advice that comes from myself and the Premier. Ultimately, we're asking people to do their best, whether it's legally required or whether it's a strong encouragement and advice. Please do your best. Follow and use common sense. This is all about keeping staying in our household groups for now, while you still get outdoors. Keeping household groups at least 6 feet apart from each other, minimizing the chance from the virus to spread from one group to another. or as I said, it's our ability to open things up further will depend on how we do with these initial adjustments and how well Nova Scotians comply with those. It will also be based on our Nova Scotia epidemiology and other local data. We're going to be looking very closely over the next 2 to 3 weeks to see what is the impact on COVID-19 transmission from starting to ease some of these public health restrictions and allowing people to get outdoors in a more robust way. It's really important that we do this slowly and carefully. The last thing we want to do is undo the progress, undermine all the hard work and the sacrifice that people have made to date. I know that may sound hard, but it's going to take some time to get ourselves out of this. And the last thing we want to do is set ourselves back, because ultimately that will prolong and mean that we have to stick with stricter public health restrictions for a longer period of time. The Premier and I are absolutely consistent in our thinking together that it's better to be doing this carefully and cautiously and being slow on this, because ultimately being slow will get us to our end goal faster. And now is not the time for us to kind of let our guards down. We need to continue to do the work that we have been doing to flatten the curve. So I want to end by thanking everybody for their patience, for their adherence to the strong public health measures that have been necessary and are continue to be necessary to protect not only ourselves, but to protect our loved ones, protect our neighbors, essential workers such as healthcare workers, grocery store workers, our first responders, and also those who are most vulnerable in our communities who may not have the ability to protect themselves or be at greater risk for severe disease. It's for all those people we're doing it for, not just for ourselves. By acting together, having a strong positive sense of community and knowing that by doing these things we're actually caring for each other, we will get through this and we will then start to be slowly further continue to ease restrictions as the weeks come. Thank you, Premier.
Thank you, Dr. Strang. As Dr. Strang has just said, this is what things will start looking like as of now. A slow and steady opening for our province. I want to tell you may have listened to the list of things the doctor had talked about. It really is our concern and our worry is really about your health and your mental health. These are abilities for us to be able to open up our province, at the same time being able to follow the public health protocols around the 6 feet distancing, washing our hands regularly, and following the advice of public health. I want to tell you, as we start moving about, let's make sure that we continue to follow those protocols, because it'll be critical if we move to the next step of trying to bring our province back to some level of normalcy. I've also asked Minister Delory and Deputy Minister Orrell from our Department of Health to begin conversations with our healthcare leaders around opening up short stay or day surgery procedures as well as clinics. This will be the first step in trying to understand how to open our healthcare system up under new protocols. We put financial measures in place for businesses to try to help them manage while being forced to close because of COVID-19. But I know reopening will be the best remedy, so I've asked Dr. Strang to work with the appropriate departments to begin conversations with a range of sectors, including restaurants, cosmetology, small businesses, sports and recreation. We need to work together to figure out what a new normal looks like. And it is my hope that a roadmap will start to take shape as conversations about opening our economy take place. Now, we'll be happy to answer any questions that you may have.
Just a reminder that each reporter on the line will get one question and one follow-up in the amount of time that we have allotted for today. First question goes to CBC's Mike Gorman.
Hi, thanks. First question, I'm hoping both of you can actually speak to this a little bit, but Premier, you talked at the beginning in your remarks about people's mental health, and I'm just wondering, as you looked at when to start easing restrictions, to what extent the mass shooting played into the decision to start reopening this week?
I think it's been a culmination of not only that, the number of dealing with COVID and the isolation of COVID has been obviously taken a tremendous amount of pressure, particularly if you're living alone, if you have small kids at home, raising them by yourself, dealing with an elderly parent at home, having to be isolated without any external support is obviously challenging, particularly for this length of time. There's no question the tragedy of 18th and 19th been heartbreaking from one end of our province to the other. Every organization has been impacted. We've all felt it. And then, of course, yesterday, the Canadian Armed Forces are an important part of who we are as a province. We're the home to Canada's Navy. But we also have the Air Force here in Greenwood and Shearwater. The Army is here. We have a huge number of reservists. They make up who we are as communities. And all of that tragedy and all of that heartache, quite frankly, would be challenging enough in the best of times when we can actually go out and communicate with our family and loved ones and be able to mourn together. So it became apparent that while we are not out of the woods at all when it comes to COVID, we have to figure out a way to balance our continued pursuit of COVID by following public health protocols, at the same time supporting individuals' mental health and our community's mental health. It'll be good to see family units walking in our parks, not having a picnic, but walking through our parks. It will be good to see neighbors who decide they're going to drive their ATV. It'll be good to see some level of activity within our province as we continue to chase COVID and hopefully provide ourselves this weekend with just some level of happiness.
Mike, do you have a follow-up?
Yeah, thanks. Dr. Strang, I'm just wondering, in terms of this balance of reopening and measuring how it goes, what for you is the litmus test for how this is all going to work? Because there's even some ambiguity today. I appreciate you saying use parks that are close by, but if you have to drive, don't pull in if you're seeing a lot of cars. And I'm just wondering if the parking lot at Point Pleasant Park is rammed tomorrow and there's a long lineup at garden centers for people trying to get in to get supplies there. How are you going to gauge whether or not these measures are being adhered to responsibly, or if people are trying to turn on the taps too quickly?
So that's one of the things we'll be looking at. We don't have a systematic way of doing that, but we have a number of ways through. We certainly hear the Premier's office hears a lot from community members. I get a lot of emails. People, some people want to be free, but also lots of people complaining they're seeing such and such happening in the community. So I think we have a pretty good sense of how of what actually is happening in communities. This is one of the things we're looking at. Can we all work together, use our common sense, and be reasonable about this, and just making wise choices? And if we're not seeing that it's happening, or there's lots of ways that's not happening, that tells us that perhaps we've got too much risk for the transmission of COVID, and we perhaps need to tighten things back up again. The other thing we're going to be watching is in the next week to 2 weeks, what are we seeing the impact of this weekend and loosening restrictions in the coming week? What is happening with our epidemic curve? Are we seeing an increase of COVID-19 again, especially in cases that we can't explain where they might have been exposed? So both what we're hearing and seeing in communities about compliance and acting in a common sense and responsible manner versus what we're seeing with that in our disease activity over the next, knowing that what happens this weekend, it may take a week to 2 weeks for people to, if they're infected, to actually become sick and be tested. So it'll take us at least a couple of weeks to be monitoring and watching this, and that's why one of the reasons we say the steps as we are in a recovery plan necessarily have to be slow, because every step that you take, then you need to give yourself several weeks to monitor the impact before you can go to the next step.
Next question will go to Suzette Billiveau with CTV.
Good afternoon, and thank you. I'm wondering what the protocol will be when people are at the parks and on the trails. Will will the police still be patrolling these areas? And if so, will fines still be handed out if people are not adhering to the guidelines, staying 6 feet apart?
So we've been there's a communication that was developed today that's gone in the last hour to our police chiefs to understand the new rules. They still play a role in this around compliance and enforcement, and so they're part of what's going to be out there watching as well. One of the things we'll be monitor is the intelligence that we get back from police and on what they're seeing in the community. So they do play a role, but police aren't everywhere. They can't be everywhere, and we can't be relying solely on policing and enforcement to adhere to what Nova Scotians need to do or what they've been asked to do. A lot of this needs to come back to can we all collectively be responsible? And again, this is not so much about ourselves, but doing what's necessary to minimize the chance of COVID-19 to spread, so we're protecting others in our community. So can we collectively be responsible as we open up the outdoors, but do that in a safe, responsible way? And some of these, there's lots of questions people may have, and I would ask people just to think your way through it. Use your common sense. Can I do this that's going to keep me separated from other people that aren't in my household? And if I can't do that, then I have to make sure I'm doing it in a way that's 6 feet apart.
Suzette, do you have a follow-up?
Yes, just a quick question just regarding sport fishing season. I know a lot of people were confused this morning. Some businesses were selling permits, some were not. Is there a reason why that information wasn't sent out or alerted this morning to businesses and to people eager to go fishing?
Well, we were waiting to make the announcement today. We realized yesterday that there would have been a slight error had been made, and when the direction was given around sports fishing, that we should have actually made it for another 24 hours. So it created a small window with a bit of confusion, but I don't believe that's a huge issue. And now certainly we've got clarity that people can actually go sport fishing, whether it's a boat or on the shore, while they're still doing it in a way that respects household groups, respect social distancing.
Next question will go to Global's Alicia Draus.
Thank you. I'm just wondering if you can talk a little bit more about what you guys are going to be looking for in terms of the numbers. Obviously, our numbers of COVID have been fluctuating daily already. So what kind of increase, would be problematic?
So there's no firm number on that. In fact, what we are looking to do is we watch the pattern of cases over time in what we call our epidemic curve. And in the last week, we've seen in the last few days an encouraging continuing trend downward, especially when we realize that many of our cases are still coming from a Northwood outbreak, which is frankly a separate issue. So if we look at our non-Northwood cases, we've actually seen some very encouraging news. So we want to actually see that downward trend continue. But as I said the other day, it's not just the number of cases, it's the type of cases. So when we have a case, we identify close contacts, we're testing those individuals, we expect that some of those close contacts in their testing are going to come back positive. But it's those are very different than if we get new cases where we don't know where that person, they're positive, but we have no idea where they might have been exposed. That second instance is a much more concerning. So it's both a continuing reduction of cases, but also can the cases be explained and they're understood by us, or are they cases where we actually don't know where they've been exposed? And those are the ones that are much more concerning because they must have been exposed somewhere in the community in Nova Scotia. And those are the ones that are much more of an indication of ongoing community spread.
Alicia, do you have a follow-up?
I do, and this one's just in regards to parks opening up. The parks and trails are open, but you mentioned, families still shouldn't be going out for picnics. So can you just give a little bit of clarity of, can families go and play catch or play soccer in a park, or is it just kind of more moving through a park?
Well, and we're asking people to, really not putting the restrictions on what they do, but it's really doing it within your household group, so people you're already living with, because you're already within that, in all likelihood, within that 6-foot social distance within the house. So if you go together, go outdoors, and there, use your creative ways that you can be together outdoors. We're not putting limits on that, but we're at the same time we're saying if you're going to interact with other household groups, then you got to do it in a way that maintains at least that 6-foot that 6-foot distance, and we're not passing things back and forth even across that 6 foot that could allow the virus to be spread from one household group to another.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. This is for Dr. Strang. You say in the news release that beaches are not included in the easing of restrictions, but some beaches are provincial parks. Can you just clarify how people are going to know which beaches to go to? If they're a provincial park, are those beaches open?
No, beaches are closed. So if there's a provincial park with a beach, the park is open, but the beach component of that park is not open. We hope to do that soon. We've taken some initial steps today, but things like beaches, like playgrounds, we need to have a bit more time and understand the impact of these initial steps before we can take the next steps to further open up outdoor activities.
John, go ahead with your follow-up.
Thank you. This is for Dr. Strang as well. I've been talking to doctors who are worried that situations such as child abuse and the identification of symptoms for diseases such as type 1 diabetes are not being reported, or in many cases are not being reported because of the fear of COVID exposure. Just wondering what we are doing to get the message out that people shouldn't be afraid of the doctor's offices and emergency departments.
Well, we continue to have a healthcare system that certainly in our communities, primary care is available. Physicians' offices are open. Much of that care is done virtually, but it's still there and accessible. And we've several times brought forward the message through these briefings that if people need, whether it's primary care or they need emergency care for that's not COVID related, or they can emergency rooms are open. If they're not sure, 811 telehealth line is still open. We're using it for COVID related, but if people have questions about their health and they're not sure where to go, certainly calling 811 is there for the non-COVID questions as well, and they'll give the appropriate triage and direction. So certainly the healthcare system is open to, still has remained open to a significant extent. What the Premier has talked about, and the discussions are starting about how do we more robustly open up the healthcare system, especially our hospitals, to deal with people with all types of surgeries and or other needs that need hospital-based care.
Next question will go to All Nova Scotia, Lindsay Armstrong.
Thank you. For the Premier, in regards to the ease restrictions, can you lay out which of these are changes to public health orders and which are not? Parks and trails that were closed are now open, which is new, but garden centers that were able to follow physical distancing guidelines have been able to remain open. So can you clarify which things were ordered to close and are now open, and which were suggested to close and the advice has now changed?
So I can go through that list. So we know that under the public health order, we had closed schools and daycare. And just to remind folks, those remain closed and up until and including May 22nd. Under the public health order, we had actually closed a private campground. So we're opening up private campgrounds for seasonal campers. The closure of municipal and provincial parks and trails was actually done under the emergency or the declaration of a state of emergency, and they're being opened up by a revision on that declaration, and that in that declaration is also including the clarity that beaches and playgrounds remain closed. The restrictions on fishing were actually done as a directive through the Department of Fisheries, and it's through their directive that we're now opening up the fishing season.
Lindsay, go ahead with your follow-up.
Oh, thank you. This is the first easing of restrictions we've had in Nova Scotia. I'm wondering why this step came before the province shared any of its plans for reopening.
So it's going to be a phased approach. As I said earlier, this is, first of all, Nova Scotians have, in the last 7 weeks, have been working with Dr. Strang in public health. This has been a lot for our province to cope with in the last number of weeks, not only with COVID, but with the amount of death, quite frankly, that has been thrust upon our province and its citizens. The decision working with public health was really about people's mental health. And how can we move people from isolation, allow them to get out to walk around, potentially do some of the things they might like to do, at the same time protecting them from COVID, whether it's going to a golf driving range or going sport fishing, whatever the activity is that you could do safely with your family and your household unit together. We wanted to provide Nova Scotians with that outlet. It's no exaggeration that we were worried about people's mental health. This has been tough on people, on communities, and that's what this has been driven by. We've been very clear, both Dr. Strang and I have been here almost every day for 7 weeks, about the economic move, how we're going to work with that. I announced today that we're reaching out to the associations that represent a good number of the service sector. I didn't list them all, but we'll work with them to begin to talk about what does the new normal look like when we start to open up our economy? And we will do that starting next week and move forward. We talked about what we're going to do with the new normal around healthcare, short stay operations, the day surgery. How can we look at some of those today? Because of the work of Nova Scotians helping us protect our emergency rooms. But this is about trying to find the balance of giving people an opportunity to find a new way, a new outlet for themselves and their family to feel better about the self-isolation, and quite frankly, to get out with the amount of death that we've, as a province, have had, and hopefully it'll help them do that. And you know, there's been many questions about how we're going to know this, how we're going to know that, who's self-isolated, all those things. Listen, all of the things that I see, it's not children doing it, it's adults. When we had a problem with too many people on the beaches, it wasn't kids doing it, it was adults. Spending at the grocery store or the other stores, it's not children, it's adults. What we're asking all of us is to share in this journey. We don't like putting restrictions on to protect us around COVID. We just need all of us to give each other a bit of a break so that we can somehow find our way through the dark days that we just have been coming through, and yesterday at the same time fighting off COVID. That's what this is about. We have not lost sight of the economy. We have not lost sight about how we're going to work with our private sector. Right now, this is about Nova Scotians and trying to help all of us deal with what we've been asked to deal with.
Next question will go to Olivier Lefebvre with Radio Canada.
Oui, bonjour, merci. Premier, we hear daycare availability for essential service workers is lacking. So moving forward, what's your plan to guarantee availability for essential service workers struggling with finding childcare?
That's a great question. We looked at this very early on, but you know, one of the things that has happened here, many community family members have supported the essential service workers around providing childcare, whether it has been somebody working from home was actually looking after their own children, or neighbor or community group, family members provide that support around that family unit while that caregiver went to work. We had looked at other parts in the country where they had childcare open, and we didn't see the huge take-up, quite honestly, when it came to that for essential service. But we're going to analyze that along with our education system, working with public health. And as more and more people start going back to work, we will have to find a childcare model that works for all of us. And that's where our focus will be in the coming weeks.
Olivier, do you have a follow-up?
Yeah, sure. About today's announcement, so people can now go to their cottage. But what about cottage rentals? Are they allowed or not, and why?
No, you can go to your own cottage, and if you have a seasonal camper, you can go to it. That means it's on a fixed spot, as opposed to a weekend camper or someone who's going for the weekend to someone's cottage. And the rationale for that right now is that's where we'd be cross-pollinating that particular property. More if every weekend somebody new was coming in, or every weekend we were moving trailers in and out of private or provincial campgrounds, we would potentially bringing that virus in and out every weekend. What we want people to be able to do is to be able to go out and enjoy their family cottage, get it set up, determine if that's going to be their residence or where they currently live. And the same thing for those who've had seasonal accommodations in some of our parks. They've set them up as that's their cottage. There's decks around them and they're all set up. We want them to be able to go and enjoy their property while practicing the public health protocols. And then we will look at what does the weekend camper look like as typically as we move forward. As a province, most of our parks normally don't open up until the long weekend in May. We'll look at that. But this really is about how can we strike that balance of giving people the freedom to be able to go and enjoy the things that they have, at the same time making sure that we're not continually moving that virus in and out of environments.
Next question will go to Chris Halef with News 95.7. Chris, are you there? Okay, we'll come back to you. Chris, next question will go to Tim Busquet with Halifax Examiner.
Hi, Dr. Strang. I'd like to follow up with what I was asking you on Wednesday on the COVID cluster information. In preface, I just want to say it's not me or other people releasing lists. It's people calling their doctor, and the doctor is telling them, oh, you're on this list, and those people are then posting on social media. And the MLA here in Dartmouth has posted it. So we know that the B3A postal zone is it, but that stretches from my house all the way up to the Cirque, and includes probably 7,000 or 8,000 people. And I'm just wondering how it is that you can define anything in that as a cluster when, by my count, there are only 139 active cases in the province that aren't in Northwood, and you've defined 10 clusters. So can you help me with how that works?
So we use those community clusters, and they're based on the first three digits of the postal code. As a way for us in public health to look at where we might be seeing pockets of increased activity. And you're right, they're a medium level of geographic specificity. But it actually it's been very important for us to use that to be able to tell. Even if we look at Central Zone, there's more activity in Central Zone than anywhere else in the province. But that doesn't, we were able to go by community cluster. We're able to say even within the whole HRM area, where are the community groups where we're seeing higher than average or higher than normal numbers of cases. And what that does is it allows us to say these are areas that we have to focus our attention in, and like we've done with a number of community clusters, bring in increased access to testing by standing up temporary assessment centers, because what that does is actually say, but through increased testing, helps us get more people from those communities and to really understand at a greater level how much increased disease activity is going on. And fortunately, as we've used this approach in the last couple of weeks, even community clusters which have had, have become areas of concern for public health, we've gone in and done enhanced testing, and what we're actually showing is that there isn't significant community spread. Though that community clustering at their request was given to the health authority because they wanted to use that for their internal purposes. So people coming from certain parts, especially with HRM, where there might be a higher possibility of them having COVID disease, help them make decisions on what personal protective equipment a healthcare worker would have when they're interacting with a patient, because it's important that we use the personal protective equipment we have in as efficient manner as possible. Those lists were not meant to go public, and they were not meant to help people understand what their own level of risk may be even within their community. And it's unfortunate that they are being used in that way.
Tim, do you have a follow-up?
I do. I agree that it's unfortunate they're being used that way, but they are. So my follow-up question is, I've asked Nova Scotia Health Authority for the methodology for defining clusters, and they told me they bounced that to your office. It's been 2 days, I've yet to get a response for the methodology. There seems to be a lack of transparency. Can you help me with that?
So actually, we are the community clusters are simply you take the postal code and the 3 digits of the postal code, and you actually can draw geographic lines based on those 3 digits of a postal code. The same you could do if you use a full 6-digit postal code. You get more refined geographic areas. So there's no sophisticated formula. It's just the geographic line that Canada Post does, to which they assign a single postal code, whether it's the 3 digits or the full 6 digits.
We'll go back to News 95.7. Chris Hellef. Chris, are you there? Next, we'll go to Kyle Shaw with The Coast.
Hey. Dr. Strang, about your restriction loosening today. Are municipal parks open now by this order, or do municipalities have to do something to actually officially open them?
No, by this order, the emergency under the revised declaration of emergency, municipal parks are also opened, along with provincial parks and trails.
Kyle, do you have a follow-up?
I do, Chrissy. Thanks. What about surfers and skateboarders? Are skate parks open? And are surfers allowed to cross beaches to get out to the water as long as they don't linger on the beaches?
So the first part, skate parks are part of a park. So if the park is open, the skate park is open. And if beaches are closed, they're closed for people on the beach as well as people in the water.
Next question will go to Maurice Reese with the South Shore Journal.
Thank you. Dr. Strang, as you look into your crystal ball and looking forward, what do you see coming down as they try to save the summer for artisan shops or antique shops, souvenir shops, possibly being allowed to open?
So, first of all, we have to understand that there's a small number of businesses like restaurants and some healthcare, community-based healthcare providers that are closed. But the vast majority of businesses are actually have never been closed. They've just been told that to remain open, they have to be able to follow rules around people have to be able to be 6 feet apart. And if they can't necessarily be 6 feet apart, then there's minimum numbers of 5 or less that have to be in that business environment. So most of the ones you just referenced have never been closed. And we continue to work, as the Premier said, we're moving forward with our recovery plan. The business sector, whether they're large industries or small businesses, they're part of the conversations we're going to be having in the coming weeks, so they understand what the public health principles they need to continue to adhere to. But we're going to be asking them they know their business environment best. How can they creatively continue to expand and open their business while still adhering to those public health principles?
Maurice, do you have a follow-up?
Yes, thanks for the clarification, because I have spoken to several like antique shop owners and artisans, and they understood that they were not allowed to open. So that would be good news for them.
And that's all the time that we have today for questions.
Thank you, Chrissy, and thank you all for being with us today. We are opening up a little, and that is good news in the midst of all of our sadness. As I said before, I am worried about how everyone is coping. So get out, get fresh air, do a little physical activity, and hang with your family is the best medicine right now. But remember, this is not a free pass to full freedom. These are small but meaningful steps. We still have to follow Dr. Strang's protocols. Keep your distance, wash your hands, and if you go somewhere, do your best to walk there. No gatherings except with your household family unit. As always, for those you cannot visit, find your best way to connect with them. What we've announced here today is a start. We need to know it can work before we can do more. Don't look for loopholes and don't bend the rules. And if we can all work within these new guidelines, in time we will open up more. We are not ready to open up our entire province, not yet. We are still doing hundreds of tests of COVID. In fact, we are testing on a per capita basis more than any other Canadian province. And we are doing that because we want to find any traces of this virus anywhere in our province and isolate it. The worst thing that we could do right now is to open up and have a relapse. We are all opening up. We are also opening up gradually because we need to protect our frontline healthcare workers, the very people risking their lives to save others. And don't forget, when you were outside this weekend, they are going inside to protect some of the most vulnerable citizens in our province. And they are doing that by being careful. So we need to be careful too. We keep saying that we will be stronger when we come out of this. I believe that because I believe in this province. But our strength is not only our physical health, it is your mental health too. They go hand in hand. You may have heard Dr. Strang talking about mental health a lot today, because it is critical that we as a province look after our individual and our collective mental health as we continue to move looking after COVID-19. So take time this weekend to do something for you and for your family. You've earned it.